For AML, there are a number of developments as well. The new approval this year is the oral azacitidine, but that's in the maintenance setting for patients who have undergone intensive induction chemotherapy who are not eligible for curative therapy. Oral azacitidine in those patients as a maintenance therapy has shown survival benefits, so that's been approved. So that's exciting in that patient population. I think AML in general, for older patients, Venetoclax has become more or less the standard of care, and phase III trial with azacitidine plus Venetoclax versus azacitidine has proven that, shown that Venetoclax plus azacitidine is beneficial. So it is currently the standard of care for upfront patients with AML. I think what will be developing over the coming years is about how to improve upon that, and a lot of exciting therapies are in clinical trials combining with Venetoclax with hypomethylating agents. And also another exciting prospect is how to integrate the oral hypomethylating agent with oral Venetoclax, because if that is possible and that is safe and efficacious, then it is possible to potentially have all oral regimen for induction therapy for older patients with AML. So those are exciting developments for AML.